Grarbet Tehadiso Mahber is a non-governmental organization registered under the Ministry of Justice. It is a charity dedicated to improve the lives of the rural communities in central Ethiopia. It provides rehabilitation and treatment services to people with post-polio paralysis, epilepsy, hard hearing, and the visually impaired. Its comprehensive eye care service includes the control of trachoma, the commonest infectious cause of blindness in the rural communities of Grarbet's operational area. The vision of Grarbet Tehadiso Mahber is to see an Ethiopia where avoidable blindness is eliminated and people with disabilities rehabilitated to become productive citizens with an improved quality of life. The establishment of Grarbet is the product of a collaborative epidemiological survey undertaken between 1986 and 1993 by the Departments of Neurology of Addis Ababa University and Umeå University of Sweden. Based on the results of the survey, the principal investigators felt the need to provide community-based services, treatment, and rehabilitation of persons with epilepsy, post-polio paralysis, and hard of hearing, who invariably are marginalized and neglected. It was also decided that eye diseases which were found to be prevalent needed special attention. The Grarbet Center at Butajira town of the Gurage zone was inaugurated in 1996. A secondary eye care center was established in the town of Batu, Zawai, in 2006. The Grarbet Butajira Center is located in Butajira town, 135 kilometers south of Addis Ababa. The health and rehabilitation service delivery catchment areas include 6 waradas, namely Meskan, Mareko, and Sodo in the Gurage zone, and Dalocha, Lamfuro, and Silte in the Silte zone of the Southern Nations, Nationalities and Peoples Regional State. In the Oromia Regional State, from a secondary eye care center in Batu or Zawai, 4 waradas, Adamitulu Judo Kombolcha, Dugda, Bora of East Shoa Zone, and Arisi Negele of West Arisi Zone are provided with eye care services. The total population being served by Grarbet in the 2 regional states is over 1.5 million. The comprehensive community-based programs of Grarbet include eye care program, water and sanitation, epilepsy, ear and hearing care, rehabilitation and vocational training. Eye care program. Over the years, eye care has overtaken all other programs of Grarbet because of the high prevalence of eye diseases. About 75% of all consultations are for eye diseases. The approach to eye care includes outreach service, consultations at the secondary eye care centers, optometry service, production of low-cost eyeglasses, and trachoma control program, including the provision of water and sanitation. For the provision of outreach eye care services, mobile teams led by ophthalmic nurses regularly visit remote villages to screen patients for treatable eye diseases. Acute infections are treated on the spot. Patients with trachoma complications undergo eyelid surgery by an ophthalmic nurse to prevent the scratching of cornea by interning eyelash, which is the root cause of blindness. Over 3,000 such surgeries are performed every year. Those with serious eye diseases are referred to the secondary eye care centers. At the two secondary eye care centers in Butajra and Batu or Ziway, patients are screened by medical assistants and later examined by ophthalmic nurses. Simple cases are treated by the specialized nurses, while complicated cases are referred to the experienced ophthalmologist. Grarbet has sophisticated ophthalmological instruments and equipment to facilitate diagnosis and treatment of eye diseases. At the center in Butajra and Batu or Ziway, ophthalmologists routinely perform intraocular lens implantation cataract surgery. More than 2,800 patients are operated every year for cataract. The Butajra Secondary Eye Care Center has in the meantime been upgraded to an eye hospital by the Ministry of Health. As part of the eye care services, Grarbet is undertaking effective trachoma control activities using the WHO recommended SAFE strategy. S stands for surgery, A for antibiotics, F face washing, and E for environmental sanitation. Mass distribution of the antibiotic azithromycin or Zithromax is carried out in all the project waradas or sub-districts every year. A total population of about 1 million is involved in the campaign. Health extension workers, community health agents, and women group leaders are given training in eye care by Grarbet to provide health information to the community on methods of preventing eye diseases. Teachers are also trained to detect refractory problems among their students, who are then referred to the secondary eye care centers for proper refraction and provision of eyeglasses for those that require them. The health workers of Grarbet, including sanitarians, are engaged in providing health education on face washing and environmental sanitation. Grarbet has an optometry service run by optometrists and nurses training in refraction. Those patients that require eyeglasses have the opportunity to purchase them from the Grarbet Optical Workshop, which provides low-cost spectacles of high standard for both internal and external needs. The workshop has the potential to produce 10,000 eyeglasses per year. On the average, Grarbet produces 7,000 eyeglasses every year. Water and sanitation. As part of the effort to prevent and control trachoma, Grarbet is involved in the provision of safe and adequate water supply. It develops springs, shallow and deep wells and roof rainwater harvest for schools and clinics. The water schemes developed are handed over to the community. Thus, the community takes the responsibility for the administration of the water sources and maintenance works. This is done through water caretaker committees that are formed and trained by Grarbet. Grarbet has a maintenance workshop well stocked with spare parts and has developed the capacity of rehabilitating failed water schemes. The workshop provides maintenance services to the community and also by making spare parts available at affordable prices. Grarbet is involved in environmental sanitation. It produces and distributes to the community environmental-friendly pit latrine slabs. Sanitarians provide health education on personal hygiene, face washing, proper waste disposal, and environmental sanitation. Epilepsy care. Generally, in rural communities of Ethiopia, there are superstitious beliefs that a person with epilepsy is possessed by evil spirit and the disease is contagious. Since its inception, Grarbet has been dedicated to the care of persons with epilepsy, together with awareness creation campaigns to change the attitudes of the people that epilepsy is a treatable medical condition. Grarbet provides outpatient epilepsy care service run by a psychiatric nurse supervised by a neurologist. The epilepsy unit also provides counseling of patients and their families on how to live with the disease. Around 900 epileptic patients are treated every month. Ear and hearing care. An ear, nose, throat (ENT) unit was established in 2005 to provide ear and hearing care. The unit provides screening and treatment of ENT infections, audiometry services, and surgery, mainly tympanoplasty. The ENT unit has currently a large number of treatment seekers. As a result, Grarbet has expanded the service to the rural areas through the outreach program together with the mobile eye care teams. It has also enlarged the ENT operation theater. Rehabilitation projects. Persons with difficulties in mobility are treated and followed up at Grarbet Hospital in Butajira. Grarbet also provides rehabilitation service to children with clubfoot who are treated with either the application of plaster of Paris or corrective orthopedic surgery. Patients with post-polio paralysis. Though the number of patients with post-polio paralysis has decreased due to the worldwide polio eradication initiative, the need for rehabilitation and orthopedic corrections will remain for many years. In the rural communities, there are still many with post-polio complications. Screening of such patients is made at the Butajira Center, where patients are provided with physiotherapy and braces. Follow-ups are made through regular visits of a mobile team composed of physiotherapists and orthopedic technicians within the outreach programs. Over 6,000 post-polio paralysis patients receive treatments each year. Grarbet Tehadiso Mahber has a well-equipped workshop for the production of aids and appliances. Braces, crutches, and orthopedic shoes are produced and adjusted at the workshop. The workshop also produces low-cost foldable white canes for the blind. The white cane is distributed to the blind after they are given mobility training. Vocational training. Grarbet established a vocational training program in 2005 for the visually impaired and the physically disabled persons to equip them with practical skills that would make them productive, self-supportive, and self-confident members of the community. Since the establishment of the Economic Empowerment Program, 400 persons have been trained. Of these, about 70% have become well-established and profit-making. 3 groups have become organized into associations that have joined the local microfinancial schemes. Future plan. Grarbet Tehadiso Mahber has a plan to make the Grarbet Hospital a center of excellence in the eye care as well as ear and hearing care. Grarbet is designing mechanisms to ensure sustainability through income generation, develop and improve the efficiency of outreach programs, expand screening of patients from within the community, reach more children with post-polio paralysis, educate and expand epilepsy treatment, and identify more patients with ear infections and hard of hearing. Most of Grarbet's services are targeted at the poorest of the rural population and those that cannot work because of their disabilities. Grarbet has many individual donors and supporters within the country and abroad. Their understanding and support have always been the most valuable. The past and present donors and partners of Grarbet are listed below. Västerbotten Association for the Neurologically Disabled, Swedish Organization of Disabled Persons International Aid Association, Rotary Clubs, local and international, Christoffel Blind Mission, Orbis International Ethiopia, Foundation Dark and Light Blind Care, Light for the World Christoffel Development Cooperation, Vision Aid Overseas, International Trachoma Initiative, Lavelle Foundation for the Blind. Partners in the Horn of Africa, the 3-Aid Foundation, and Rainbow for the Future. Grarbet also acknowledges with gratitude the full support of all responsible government agencies in general and the following governmental line offices of the Southern Nations, Nationalities and Peoples, and Oromia Regional States in particular: Finance and Economic Development Bureaus, Health Bureaus, Water Bureaus at the Wereda, zone and regional levels, the municipalities of Butajara and Balkhi or Zuwan. We believe that